the last section of my lecture today, Introduction to Pharmacology. Now, you acquired the patient data, you created a differential diagnosis, and you applied your patho knowledge. Now, the final step, how are we gonna treat this patient? What's the best treatment for this patient? If it was a medical treatment, we need to know some information about drugs, and this is the science of pharmacology. The drug is any chemical that affects a normal physiologic process in the living organism. Remember, there is no drug that is going to make you fly, because you have not been created to fly. So drugs do not do miracles. Drugs just help a normal physiologic process to restore its normality. So don't ask a drug to do more than it is supposed to do, or don't ask a drug to do more than the normal physiology of the human being can do. Any drug is going to have three names. Chemical name, which is a very long and difficult name, the generic name, and we will go by generic names. Generic names end with suffixes that are constant for the whole group. Let me give you an example. Any drug that lowers the blood lipid belongs to the group of statins. So simvastatin, atorvastatin, rosuvastatin, all these are statins. So the class is statins, and they will all end with this suffix statins. ACE inhibitors, they all end with the suffix of pril, lisinopril, enalapril, catapril. So whenever it sounds like pril, you know it is an ACE inhibitor, and so on. Of course, the trade name is a catchy one, but it changes, and I don't recommend going by trade names, so we will keep going by the generic names of drugs. Pharmaceutics is what? It is, how are you going to put this drug? Are you going to put it as a tablet? Are you going to put it as a capsule, or maybe as a shot? So this is how you're going to formulate the drug. Pharmacokinetics, this is what does your body do to the drug. What does your body do to the drug? And we're going to talk about it. Pharmacodynamics is what does the drug do to your body. And finally, pharmacotherapeutics, what are the clinical indications for this drug. I'm going to leave the rest for you to review. Now, pharmacokinetics versus pharmacodynamics, very important aspects for any drug. Pharmacokinetics, what does your body do to the drug? Notice this kinetic part of the name, kinetics. Your body moves the drug around. First step, absorption. Your body moves the drug from the site of administration of the drug to the system or to the blood. This is what is meant by absorption. How the drug gets into the body, or let me be more specific, how the drug gets into the system, which is the systemic circulation. So you apply a drug as a transdermal patch. So how does it reach the blood? This is absorption. How does your body move the drug from the site of administration to the blood? Then distribution. After you have absorbed the drug into your system, into your blood, your body is going to move the drug around the all body compartments, and we call this distribution. Metabolism is some sort of a chemical movement of the drug. Your body moves the drug one step down to become more water soluble so that you can get rid of the drug by the final step, which is excretion. Absorption, distribution, metabolism, excretion, they have the famous mnemonic ADME. Then pharmacodynamics. How does the drug affect your body? And the key word in pharmacodynamics is receptors. Drugs act on receptors in your body. We have receptors already found in our body. We have receptors for epinephrine, we have receptors for acetylcholine, we have receptors for insulin, we have different receptors for different chemicals inside our body. And the pharmaceutical companies, they design the drug to work on the receptors that we already have in our body. So how does a drug affect your body? By affecting your receptors. And also, some drugs affect some enzymes in your body. Some drugs can inhibit enzymes in your body, as ACE inhibitor, which is angiotensin converting enzyme inhibitor. So these will affect your body by affecting enzymes in your body, and some drugs act by some non-selective interactions. How do we administer drug? Well, other than the topical drugs, what are the topical drugs? You apply the drug where you want it to act. You want the drug to act on the skin, topical cream or ointment. You want the drug to act only on the eye, so you apply it as eye drops. You want the drug to act only on the ear, you apply it as ear drops. Other than that, we have two big routes of administration. If you're using your GI tract, this is enteral administration. Any other route is going to be parenteral administration. The enteral administration is the simple oral ingestion of a drug, or maybe you can put it as sublingual, buccal, and or rectal. Notice, what's the difference between oral and sublingual? Oral drugs, when you take an oral drug, you ingest the drug, you absorb it from your intestines. Before the drug reaches the systemic circulation, it has to pass first by the liver. And when it passes by the liver first, it is metabolized first, and the liver is going to extract a huge portion of this drug, and we call this the first hepatic metabolism effect, or the first hepatic effect, and this will lower the drug concentration in the blood significantly compared to the parenteral administration. When you give the drug intravenously or intramuscularly or inhalational or transdermal or whatever, any other route, the drug is going to reach the blood first and then will go to the liver to be metabolized. While in oral medications, the drug is going to reach the liver first to be metabolized and then will reach the blood, and this will lower the drug concentration in the blood. Sublingual route, as when we take sublingual nitrates for heart attacks, sublingual route partially bypasses the liver, because when you take the drug sublingual, part of the drug, which is the minimal part, but still is going to be effective, part of the drug is going to be absorbed directly into the sublingual veins into your systemic circulation, and the majority of the drug will be dissolved in your saliva, and you're going to swallow them, and it's going to follow the normal oral route and will go to the liver first. Cmax is the highest concentration of the drug in your blood, and the drug reaches its Cmax at a time we call Tmax. And we need to know this Tmax for drugs, because at the time of maximum effect of the drug, you will expect the maximum therapeutic effect, and you will also expect the maximum side effects. Bioavailability is the fraction of the drug that will finally make it to the system, and it depends on absorption, and of course for all our drugs it also depends on the hepatic metabolism. Half-life, which is an important pharmacokinetic concept, is the time it takes you, or it takes your body, to lower the blood concentration of the drug by 50%. And of course, this depends on your ability to get rid of the drug. So this depends on your activity of the kidney and your kidney function, or what we call the clearance of the drug. An important aspect when it comes to pharmacology is the drug interactions. When you give your patient, or when your patient is receiving more than one drug, drugs can interact with each other. They can oppose each other, or they can augment each other and increase each other's toxicity. Drugs can interact with another disease. You give a patient some drug for headache, and it happened that this patient has a liver disease, so this headache drug is going to interfere, or it's going to interact with his liver condition, and this could create problems. Drug-food interactions. Some food will help drugs to act better, or will affect drugs in a negative way. And drug-herb interactions is another important point to be considered when it comes to pharmacology. So, some examples of pharmacokinetic drug interactions. Some drugs can interfere with the drug absorption, as the antacids, the calcium, magnesium, aluminum. That's why we advise our patients taking any antacid, separate the antacid from any other drug by 2 hours at least. Protein binding will interact with the distribution of drug, and this is very famous when it comes to a drug like warfarin. Warfarin has low affinity to protein binding. So once you take any other drug while you were taking warfarin, warfarin is going to be kicked out of the plasma proteins, and more warfarin is going to be free in the blood to increase your blood, to make your blood thinner, and you will have higher INR, and you can have the possibility of bleeding. For the metabolic for the metabolism interactions, the CYP system is a huge enzymatic system in the liver. Some drugs will inhibit this system, some drugs will induce this system, and this will affect the metabolism of other drugs. And finally, we have the pharmacodynamics drug-drug interaction, and we are going to point to the important and relevant application of these principles in due time.